Thanks, Cahirlock, and thanks to Anna and Shane and Grace for your very insightful testimony today. And obviously, the report from the Tala Drug Task Force was kind of, I suppose, an alert, even though you have seen it on the ground that this is a very ongoing, evolving situation, but it's an alert to wider society on what should be done. And I'm quite slightly sceptical that society can act and the government in situ can act in relation to this situation. And I think the last 25 years, the situation has come a long way. The drug industry has evolved, but has society and has governments, have they evolved into how to tackle this situation? I would argue they haven't, and they've actually failed probably very, very miserably. And I think, I've said this many, many times, I think we have to have a different approach on the way, how we approach the use of drug use in society, right? I just think the present policy doesn't work and it's counterproductive. So we have to look at something different. It's not easy. It can be very, 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 very ugly. Very, very ugly, but we have to do it. And other jurisdictions have showed that a different approach is there better outcomes for everybody. And it's worrying, as Anna said, that the community approach, which was the cutting edge. Remember, this was the cutting edge back in the 80s and 90s in relation to approaching drug use around communities that were literally obliterated, working class communities. So they were the cutting edge, and they always will be the cutting edge in relation to, I suppose, tackling drug use in communities. So with that, and I know Anna's, there was a web seminar 2 weeks ago, and it's literally striking the figures that Citywide brought out last week. Since 1996, there's 225% rise in drug deaths in Ireland. 500% rise in drug prosecutions. So what does that say? It says a lot. It says a lot that the present policy doesn't work, and we have to look at something very, very different. But just to hear now in relation to what's happening in the Tala area, and obviously there is an issue with resources. I think Fintan O'Toole had a really good article in the Irish Times on Saturday. He said about, if you look at what was given in 2010 to 2021, there's actually a reduction of resources to Drug Task Force. Now, what does that say about society? But just for Shane and Grace, if this is left unchecked, which hopefully it will be kind of addressed with more resources and other things, need more societal kind of approaches to this. But if this is left unchecked, and we've seen what happens if things are left unchecked, what is the consequences in years to come?
Thank you, Deputy Kenny, if it's okay to jump in on that. And also going back to Deputy Horgan's response, how will we know if this goes unchecked? It's going to be visible from the statutory bodies. Our colleagues in the statutory agencies will be the indicators of this. We will see metrics by increased, I suppose, displaced people moving into homelessness, more visibility of that, more homes being lost, more health issues. The public health issues will increase. We are definitely going to see a rise in bloodborne viruses. We're going to see more children in care, and the visibility within the community is going to increase as well. We can guarantee this. I suppose we're only looking at a very small sample of 2 evenings a week since September, and we've already found multiples of individuals that we haven't been in contact before. This could be, and I think we'll have to be sensitive to this, that it's a small, I suppose, sample of a few weeks, 12 weeks that we've been doing this, but we'd have to be cognizant that this could be a sleeping giant, how big this issue is out there. And I suppose looking and reflecting on Fintan O'Toole's articles, having Kitty Holland coming out with us, and going back to the Rabbit report, I find it hard to say anything different that hasn't been said already. the infrastructure mightn't be equipped to manage this without real reflection on the values of what we want to achieve from a drug strategy. So I think that has to be established about what is the government's position and what do they want community projects to achieve. We are positioned to do it, but we need to be able to do it. Thanks, Deputy Kenny.
Thanks, Shane.
I'll just come in there, Chair, if that's okay. And thanks a million for that, Deputy Kenny. Really appreciate it. And exactly to just, I suppose, in terms of what Shane is saying, and you're asking what could happen. But when you refer to Fintan O'Toole's article, I thought it was excellent as well, Gino, in that it says not only is a public health crisis, could that happen? It is happening. This is what's happening. This is why we did the research. We did the research, I suppose, to evidence what we've been talking about since 2017. And here we are now coming into 2022, and we're no further along nationally. Locally, I feel we've done something in terms of trying to address firefighting, if you like. We want to focus on changing the narrative. We want to focus on changing drug policy more widely. As Anna said, you know, we're losing that, I suppose, because they're withdrawing the community voice from the national structures. So we have to have that at the background. So the public health crisis is happening now. And I suppose another reason we did the research was we knew the issue around crack was supposed to destroy communities. But we also wanted to be ready for something else that could be coming around the road, which is crystal meth. We want to get a hang on this before obviously preparing for something that we don't want to happen as well. So the public health crisis is happening now, and we just don't want it to grow. So I think what we're talking about here today is in terms of putting things in place, and the discussion needs to be happening with the Minister, with the Drug Programme Unit, and I suppose everyone needs to be at the same table in terms of the HSE addiction services as well need to be equally empowered. But for us at the moment, through the research, and I suppose why we've come here today, is resources in the first instance, why we know the other piece needs to change. And as Fintan O'Toole said as well, we need to learn those lessons of the past. The task forces were established at a time of crisis. Let's try and get ahead of this even now if we can.
Okay.
Thanks guys. Thanks, Gerald.
Thank you.